chronic fatigue syndrome? There are many people who suffer or experience immense level of fatigue even by doing minimal work. A small walk, or else just doing a small kitchen work, or just completing a simple project can make someone very tired. What exactly this is? This is chronic fatigue syndrome, a condition usually ignored, undiagnosed, and is left with no treatment. Eventually impacts quality of life and make an individual's life worse. There are many conditions and disorders that leave you with lot of tiredness. Are you someone who experiences tiredness with doing simple tasks or simple chores? You find managing this fatigue uncontrollable? Then you might be suffering from something called as chronic fatigue syndrome. Chronic fatigue syndrome is a medical disorder in which there is an immense level of muscular fatigue felt by an individual after doing exertional activity. This is a disorder which usually have no known cause but has a lot of associated impairments, at the same time disorders that can impact and cause you this fatigue. So in this video, we are going to understand what is this chronic fatigue syndrome, why does it happen, what are the symptoms that you will experience when you have chronic fatigue syndrome, how do you manage that chronic fatigue syndrome, what are the different conditions that can exactly look like chronic fatigue syndrome, and what is the benefit of doing regular exercises, and what can help you to get out of this chronic fatigue syndrome. All of this in this one video. So it is super important for you to watch this till the end. Let's begin. Chronic fatigue syndrome in medical terms is called as myalgic encephalomyelitis. This condition is characterized by post-exertional fatigue of muscles. Along with the fatigue of muscles, the person suffering from this disorder will also experience cognitive impairments. He will have sleep problems. He will have autonomic dysfunctions. He or she will also experience muscular pain of unknown cause. And all of this, when will get severely affected, will eventually lead to reduced quality of life, reduced productivity, and high morbidity. But you must be wondering, what causes this chronic fatigue syndrome? Well, chronic fatigue syndrome is a mysterious disorder. It stays with unknown cause. However, there are a lot of links associated with other disorder that can eventually lead you to chronic fatigue syndrome. These eventual links are: number one, if you have got hormonal imbalance. For example, if you are suffering from thyroid disorder, or else if you are suffering from PCOS, then you are likely to experience chronic fatigue syndrome. Even women who are at their menopausal stage are at higher risk of developing chronic fatigue syndrome. If you are someone who is going through mental health issues like depression and anxiety, then you are likely to experience chronic fatigue syndrome. Even autoimmune disorders like rheumatoid arthritis, multiple sclerosis can eventually lead to the symptom of chronic fatigue syndrome. That's not all. People who have history of an infectious disease or hematological disorder can also experience chronic fatigue syndrome. As mentioned, why these people experience these disorders still stays a mystery, and doctors are trying to decode it. However, persons who experience this require immediate attention. But what are the cardinal symptoms, or how a doctor or else a physiotherapist can determine that this person is having chronic fatigue syndrome? Well, this total diagnosis of chronic fatigue syndrome depends on symptoms and history. Hence, it is very important to understand what are the cardinal symptoms of chronic fatigue syndrome and what are the signs and history that the person will explain when he or she will suffer from it. So the symptoms that are present in chronic fatigue syndrome are: number one, post-exertional fatigue. If you do a simple household chore, or else you came back from a drive, ideally you are not supposed to feel tired. But if you are suffering from chronic fatigue syndrome, you are likely that a simple walk can lead you to tiredness. That's not all. Sometimes when this fatigue gets chronic, it can eventually give you some neurological symptoms as well, like tingling numbness, numb sensation in your fingers and your limbs. You can also experience cardiovascular symptoms like throbbing heart, at the same time feeling of palpitation. You might also experience respiratory symptoms like shallow breaths or breathlessness. You can also have your gut-related issues or symptoms like irritable bowel syndrome when you are suffering from chronic fatigue syndrome. One more important cardinal feature that can help a doctor to identify whether this is a chronic fatigue syndrome or not is the fact that if you are having chronic fatigue syndrome, sitting in an upright position for a long period of time will worsen your symptoms. Yes, you heard me right. And that's why there are a lot of people who are suffering from chronic fatigue syndrome will have an hunchback posture or else a little posture which is forward bended from their upper back at the same time in the neck. Upright sitting becomes uncomfortable and can increase or exaggerate the symptoms. This is the cardinal sign that helps a clinician to identify whether this is a chronic fatigue syndrome or not. That's not all. Repeated muscle strain and spasms are very common in chronic fatigue syndrome. An individual who is suffering from chronic fatigue syndrome, even while trying to lift a small heavy object which is usually normal, becomes exertive and can give pain. These spasms can come anytime and can be triggered by emotional response. So these are the symptoms and differential diagnosis that can help a doctor to identify whether this is a chronic fatigue syndrome or not. But when you are suffering from chronic fatigue syndrome and if you go to doctor, your doctor will definitely suggest you go for certain tests like X-ray, CT scan or MRI scan and blood tests to rule out other disorders like autoimmune diseases, psychiatric disorder or mental health disorder or rheumatic disorder, etc. There are some other associated symptoms as well that impact your quality of life while you are suffering from chronic fatigue syndrome. These symptoms are disturbed sleep, cognitive decline, poor learning ability, impaired mental processing. The things that used to be simple to solve, the problems that came into day-to-day life were simple to solve earlier, but now these problems look bigger than life. Memory decline, slowed mental processing, poor learning ability, and poor multitasking ability. These are some associated symptoms that are linked with chronic fatigue syndrome. But there are some systemic symptoms as well that will be seen in an individual with chronic fatigue syndrome. These symptoms are nausea, vomiting, irritable bowel syndrome, fatigue, night sweat, dizziness, intolerance to alcohol, uncontrollable anxiety, panic attacks, impaired social functioning, and decreased ability to work. So, as you observed, this condition, even though looks simple, but has got lot of other involved links and gets complicated as it becomes chronic. And that's why early identification and treatment is the key. Even though medical management can help, but there are certain limitations in long-term medical management, and that's where the role of physiotherapy and rehabilitation comes into the picture. So now let's understand what is the role of physiotherapy and rehabilitation in managing chronic fatigue syndrome. Well, in our terms, we genuinely believe that exercise or movement is your medicine, and in chronic fatigue syndrome, this applies absolutely true. That's why when an individual who suffers from chronic fatigue syndrome, when gets involved in a regular exercise program, this helps in release of dopamine and endorphin, which are natural painkillers and happy hormones. These hormones reduces the chemical imbalance that's going on in the body, harmonizes the body and reduces the symptoms gradually. That's the reason doing a regular physical activity which is mild, moderate or else to advanced level dependent on the current situation is the key to manage chronic fatigue syndrome. When there are associated emotional or mental health related issues that are going on with chronic fatigue syndrome, taking help of cognitive behavioral therapy also helps. There are many research papers who have shown that where CBT, which is also called as cognitive behavioral therapy, is combined with progressive exercise program, gives better and faster results in a patient with chronic fatigue syndrome. The next practice that helps an individual to manage chronic fatigue syndrome is an adaptive pacing therapy. What do I mean by that? Well, chronic fatigue syndrome is an self-paced management where more than passive treatments, proactive treatments are going to work. That's why getting patient involved in the therapy helps. When a patient or you gets involved in the rehabilitation or recovery process, starts taking proactive steps in pacing the body and the task of day-to-day living in a way that the exertion that is falling on the muscles reduces, helps you to overcome the symptoms eventually. That's why it's highly recommended that if you who are someone who is experiencing chronic fatigue, muscular pain of unknown cause, repeated spasm, then please see a physiotherapist, work on a protocol or else a strategy that focuses on pacing, emotional control, at the same time progressive exercise program in order to bring your symptoms under your control. Chronic fatigue syndrome is a disorder which usually gets misdiagnosed or underdiagnosed, but you have to take control of your health in your hand. So make sure to participate in regular physical activity. That's where I'm here to invite you for a free relaxation session that we conduct every Wednesday, 5 p.m. to 6 p.m. This session is totally focused on rewinding your muscles, rewiring your brain, and bringing sync and coordination in your movements. If you who are interested in joining this program, then make sure to click on the link mentioned below and join the relaxation session today. Thank you.